So, Dr. Wyant, why did you choose chiropractic medicine and what do you enjoy most about it?
That's a good question, because most people that do end up in my field end up in this field because they grew up with chiropractic. And for me, it was really later on, as I was already into college and studying biochemistry and knew I wanted to be in healthcare, just not exactly where. I had a teammate who was a runner who had a hip injury and went and saw a chiropractor for treatment, and she had such great results. That was really the first time I had heard of someone, younger. Most people do think of their grandparents being the people who see a chiropractor, and that was the same for me. So myself, I went and saw that same chiropractor and got great relief from headaches and insomnia at the same time as well. So that really piqued my interest to look into how it works and why it works. And the main thing that I really enjoyed about that office and then present day my office is that we see patients who are healthy and not just sick. We see patients who really want to just enjoy life and live a long, active life, and it's really unique within the medical world.
How long did you go to school?
We get asked that a lot. So I went to school for 8 years. And all of us doctors did here. We went to undergraduate schools at different places for 4 years and degrees in biochemistry. Dr. Beckner is in life sciences and Dr. DeVilly in the health sciences. And then we all went to Logan, which is a chiropractic school in St. Louis, for 4 more years, where the curriculum is much like a lot of the other healthcare professions, where a lot of classroom work at first, very heavy classroom work, and then transitioning more to just patient treatment and a lot of hands-on work. So in total, about 8 years.
So what types of conditions do you treat?
That's a big question, because we treat a lot. Really, any muscle or joint in the body that can develop a condition is what we specialize in. So from top to bottom, we can treat headaches and migraines, which are some of my favorites to treat. We see a lot of vertigo actually in the office as well and have really good success with that. Down into the neck, obviously we see a lot of neck pain, a lot of postural changes, desk work that can cause a lot of neck, and tension in the shoulders is one of the main conditions that we see here in the office. That can cause conditions that can go down into the arms, pins and needles. We do treat elbow tendonitis types of conditions, same thing with the wrist, carpal tunnel conditions. Into the mid-back, pain between the shoulder blades, and just a lot of tension and stiffness, again, from that posture being a big problem for most people. Obviously low back pain, everyone knows chiropractors treat low back pain, but there's a lot of different conditions of the lower back. Disc conditions we can diagnose and treat here in the office. Arthritis, a lot of people think there's nothing they can do about arthritis, osteoarthritis, but there are a lot of things that you can do to really keep the joints healthy for as long as possible, keep them mobile, and keep them symptom-free too. So we treat a lot of back pain due to arthritis, and same thing with the hips. Bursitis is a big condition that we treat of the hips and of the shoulders. Moving down, we see a lot of runners here in the office as well, so with that comes knee conditions, into the foot and ankle, plantar fasciitis, we can usually treat pretty successfully. So really, if you don't know, it's worth coming in and asking if we can help, because chances are we probably can.
So tell us what makes you different from other chiropractors.
So I really think there's a number of things that make us stand out, but the biggest one, and the one I'm most proud of that we hear from patients, is that we are much more thorough. Not only than other chiropractors that they've been to, but than other doctors that they've been to too. And that's intentional. That takes a lot of work to get all those systems in place, but from start to finish, we want our patients to feel like they understand exactly what's going on with them, exactly how we can help and what they can do to work on these areas on their own too, and have a clear idea of progress and expectations, and know that we are monitoring and checking and making sure that we're always on track. So, our doctors spend a good amount of time doing a really thorough examination. We have x-rays here on site that we can go over with patients. we sit down and explain all those findings to the patient before we ever treat. And that's really unique within really any medical field, to spend all that time making sure the patient understands, first of all. And then from there, we have really well-trained therapy room staff that go over home exercises and answer questions about retail products, supplements. So being thorough, I would say, is the main thing that makes us stand out. One other thing I do know is that we spend more time working on the muscles as well. So we really value, of course, a good adjustment, but the muscles are the support structure to the joints. So working on the muscles both here in the office, assigning home stretches and exercises so that the patient can help to retrain those muscles as well is important.